I'm presenting the Rehab Watch project on behalf of my team. This is a wearable monitor to predict cravings and intervene for relapse prevention and sustained recovery. So relapse rates for opioid detoxification are as high as 88%. This is only after 12 to 36 months. Of 49,000 deaths related to opioids last year, for each death there was 119 emergency room visits and 22 addiction services admissions. So our mission is to sustain recovery by intervening during periods of cravings and withdrawal. So technology is extremely prevalent in today's society. Upwards of 94% of Americans between 18 and 29 have smartphones, and approximately 89% of adults between 30 and 49 own a smartphone, as well as the wearable market, which is developing and growing at an extremely high rate, which is predicted to reach around 12.1 billion by 2021. Of this technological consumer market, our population, which is people that depend on Medicaid and local and state governments for addiction support, are very high. So what we want to try to figure out to do is how we can use this market to leverage technology and help to sustain recovery. So we want to introduce the Rehab Watch. By leveraging physiological sensing and location sensing through evidence-based techniques that can track cravings and withdrawal symptoms, we want to find ways to intervene based on evidence of calming people down when they're anxious through false heart rate feedback, and also introducing positive support messages and connecting them to their peers to help with a sustained recovery system. So during use, there's use, withdrawal, and sobriety, and then each of these have their own symptoms that are related to it. After you've used, you start to go through withdrawal, as you all know, and symptoms are correlated with periods of time throughout the withdrawal process. And then you have separate things that happen during sobriety, such as cravings that are based on locational triggers, environments, depression, stuff of that nature. So by intervening during this time, we can find ways to prevent this relapse circle. So some of the interventions that have been proven to work are things like false heart rate feedback to calm your actual heart rate down. Also guided breathing exercises, which has been shown to lower your blood pressure. Other things that have worked in the past and previous apps of use are things like recovery progress messages, giving you motivation to keep going. Also, we want to connect you to your collateral contacts, people that you love and care and that can help you get through craving. And also distractions. If we could break that cycle of thought for 1 minute, maybe that's enough to help you make a more thought out decision as to whether to use it or not again. So one important feature of our system is getting you connected to help. So using things like Oasis and OMH, we can find local services that are available that might be able to help you get through withdrawal and cravings. Also, we want to look into virtual services that can help with things like counseling through telecommunications and stuff of that nature. Another benefit is getting continuous information to providers by having automatic health scores, getting audit and DASH scores, as well as location services. But then also, upon registration of our device, we'll have basic demographic information and your relapse history, and if you're in any current programs currently. So to reach our customer, we plan to partner with local clinical groups on a small scale at first to do small deployments and understand the impact of our device, as well as what improvements need to be made. So our customer, our actual economic buyer, is going to be substance abuse providers and payers, with an end user of patients with substance abuse disorders at a price point of approximately $50 per device. We offer recovery monitoring, reduced rates of relapse through giving continuous support outside of treatment. Also connecting people to the recovery community. These are values that these communities are going to have. So current technologies, potential competitors, and potential collaborators consists of a series of apps that are utilizing different types of therapy techniques, diaries, motivational things, as well as things like your Apple Watch or your Fitbit, which can do health tracking. And future iterations of the device, we plan to also look how we can leverage these existing technologies that can use some of their health sensing capabilities to get a more commodity device. So in the next 60 days, we're going to be iterating through devices, prototyping, and doing some need finding and customer discovery. Over the course of the next year, we'll continue to do deployments on a pilot level, and then go back, do some data analysis and interpretation, and then finally get to a longitudinal study where we can see true impacts of the device. So now I want to introduce you formally to our team.
Sorry.
So I'm a PhD candidate at Cornell University, focusing in novel sensing systems for addiction. Microphone, fast.
Okay, I don't think we'll have time for that yet.
That took like 5 minutes.